So at first, register the patient. I am selecting the patient positioning head first supine because I position like this. Patient is in head first supine position and arms resting down on the table. Then enter the patient's name, then patient's ID, and then age and height and weight of the patient, and also enter the sex, male or female. The exam button will not appear if you enter all the buttons, all the options, and then from the protocols list select forearm long bone. Select first long bone and then forearm, and then from the body part exam select forearm. I am searching for forearm, but I think I am not getting it. There is no forearm in the list. So I select arm and the laterality is right because I am doing the right forearm. And now select the forearm flex coil, and here all the protocols remains. So at first the localizer is running for forearm. So let's see how the localizer images looks like. So this is my first localizer. You can see that the forearm is visible with the abdomen of the patient. So I planning for the localizer, second localizer, that is sagittal, coronal and axial, and drag the slices. I am checking out the spine coils because I don't need the signal from the spine coils. I only need signal from the spinal coil, flexible large flexible coil. So drag the slices over the forearm and also adjust the shim, and it will give you proper homogeneity of the magnetic field. And then click apply, and also adjust the positioning mode to ISO so that the table moves to the center of this planning, and click apply. Now the second localizer is running. So you can see that on the left bottom corner, then it's adjusting the sequence, and now it's scanning. It will take 20 seconds for the second localizer. I'm waiting for the second localizer to finish. So this is the second localizer. In this localizer you can see that the forearm is visible with sagittal, coronal and axial images. So now I have to plan the rest of the protocols. Like the first one is the T1 team coronal is open here. So at the middle, this is the coronal image. So you can see that there is a artifact over the image, coronal image. So I will discuss it later. So to plan the coronal image, I am planning right now on the axial image on the right side of the segment, of the right segment, and in the middle the coronal image itself, and also plan on the sagittal image that is on the left side. So on the axial image, angle the slice parallel to the forearm, that in which angle the forearm is lies. I am decreasing the slice to 15. I have increased the slice to 20 here, and also checking out the spine coils so that there is no signal from the spine coils, and it also reduces the artifacts. I also plan on the sagittal image and then click apply. And for T1 coronal, I am just copy the planning from the T1 team coronal that I done first, and I have also changed the face oversampling to 100 and then click apply. And now T2 star coronal or me 2D coronal open, and for this I again copy the planning from the previous coronal plan. And now T1 sagittal protocols open, and for sagittal I have to plan on the axial and coronal image. Slightly zoom the image and see that on the axial image I rotating the slice so that the plan is in proper angle, and there is a box appear in the sagittal image, and the slices are on the coronal and axial image. So you can move the box in appropriate position. I remain the slices in 20 in number. So this is the planning for sagittal. T1 team sagittal is planning right now. And after planning, click apply, and then T1 sagittal open, and just copy the planning from the previous planning, that is T1 team sagittal, and click apply. And now the axial planning open, that is T1 axial, and for the axial image plan on the sagittal and coronal localizer. And as the patient's complaints is near to the elbow joint or in the proximal radius, ulna, the patient's problem is in the proximal forearm near the elbow joint, so I place the axial planning over this and checking out the spine coils, only large flexible coils remaining. So if spine coils are active, it can give you unwanted artifacts, so check it that only large flexible coil is active. I am also checking the sagittal plans so that the spine coils are not active. I am checking the protocols. So this is the sagittal planning. Because my proper coronal image has come here, so this is the T1 coronal image. So on this image you can see that there is a wraparound artifact over the forearm or aliasing artifact. You can see that some part of pelvis is overlapping on the forearm. So I will remove this. So watch this video. I will remove the artifact and use some technique. I am just waiting for T2 star coronal to be finished. So this is the artifact. You can see that over the forearm there is a wraparound artifact comes from the pelvis. So this is an unwanted image. I don't want this artifact on the forearm. So for this I have to repeat and open this protocol again and plan again with adding some technique. So for this I make sure that the spine coil is not active, only large flexible coil is active. And now the phase encoding direction is on the right and left, right to left position. So I have to add saturation band on the both side of the forearm. For this, from the protocol I am adding saturation band on the right side and on the left side. On the both side I will give or set saturation band so that the any signal do not come from the both side. And I am setting the saturation band over the body, patient's body, so that no signal comes from the body over the forearm. So this is the technique to reduce the artifact. If you position like this patient in head first supine, if SAR limit exceeds, just increase TR and time will increase by few seconds. So this is the new T1 coronal that has no artifact. After adding saturation band on both sides, you can see that the artifact is removed. This is the T2 star coronal. So I am printing the T2 star coronal. For this I have selected the series and send it to the filming and set the layout 5x4 so that the 20 images set here and the segments of the films are a little bit longer, so that I select 5x4 I am adjusting the window and contrast of the image and zoom panning to fit in the segment. You can see that if you set 5:4, the segments will be long. You can now see that all the coronal images is without artifact, and this coronal image have some noise. And T1 sagittal is running. And now I will plan for the axial image because I got the proper coronal and sagittal images. So this is the team sagittal. So for axial image, plan on the coronal and sagittal image. So I am planning on the pathology. You can see that there is a soft tissue mass around the radius and ulna, and it's near the elbow joint. So I am planning on the coronal image, T1 coronal. You can see that there is 40 axial slices, and click apply and just copy the planning for the T1 team transverse. Now all the protocols have been planned, and I'm waiting for the image to be filming. So this is the planning for coronal, that I used saturation band on the both side so that there is no artifact, and also I am saved this image separately. And this one is the axial planning, the coronal planning on the axial image. You can see that the saturation band on the both side, on the over the body and over the opposite side. And after setting saturation band, the wraparound artifact has removed, and this is a T2 star coronal. I filming. And this one is a T1 coronal. Again, SAR limit exits, and for this I have to increase TR, and this is the safe option. If this notification comes, increasing TR will increase the time, scan time, but it is safe for the patient. And now the T2 axial scan is running. I am selecting the T1 coronal and send it to the filming, and the layout is set to 5:4 so that the 20 images set in the film. I take time in filming, adjusting the contrast and the zoom pan of the image. And this is the T1 star me 2D coronal. I'm sorry, this is T1 team sagittal that I sent to the film, and now in the filming I am adjusting the film, and from the browser I have select the reference image, and this one is a T1 axial image, and this is a T1 sagittal where I am scrolling and selecting the series and send it to the filming. Now in the filming keep the reference image and select an image and drag the image to the reference segment, and then adjust the contrast and zoom pans. So this is a T1 sagittal film, and this one is a T1 team sagittal film. So I have taken 2 coronal and 2 sagittal, and now and this is a T1 axial. So this axial image have noise in the image, so I didn't like this image. The reason of the noise is that this protocol's field of view is very small, it's 150 millimeter, that's why the noise came. So I want to take this sequence again. For this I have to repeat this and change the, I'm checking the coils now, that the coils are selected in FL, that is large flexible coil, but to reduce the noise I have to increase the field of view, because this is not an small coil, because this is a large flexible coil, so I have to give a large field of view to reduce the noise of the image. So I am selecting, give the 180 millimeter field of view, and I also repeat the T1. I stop this scan, I want to repeat this scan by increasing the field of view 140 to 180. So this will give me a smooth image and reducing noise. I also repeat the T1 team tra. So if you think that the image is not satisfactory, you have to repeat this, so no hurry, the image quality should be maintained. So now I am in the filming. So these images have noise, these axial images, because of the small field of view. So this, I repeated these protocols, and let's see how it appears. So I'm changing the reference image by dragging the image from the browser. So for coronal image I have to give the sagittal reference to each segment, and also in the T1 coronal film I will give a sagittal reference to each segment. So I make 2 coronal and 2 sagittal film here. So this one is a T1 sagittal, and the reference images are okay. So this is the new axial images that have the noise reduced because of the increased field of view. So I will select the series, adjusting the contrast, select the series and send it to the film. For axial image I have to select, I tried 4:10 for 40 image, but it will not work because there is no format like this. Then I tried 5 into 8, and its work for 40 images. So 40 axial images set here in the film. The format is 5 into 8. I am adjusting the image by zoom panning and the contrast. So this is a T1 axial that I repeated the scan because of the noise. And in the first segment I gave all the information of the patients and parameters. So I have make 5 films here, 2 coronal, 2 sagittal and 1 axial, and another 2 axial remains to be scanned. So this is the T2 axial image. You can see that the noise is reduced, and I select the series and send it to the filming, and in the filming the layout is 5 into 8 that is already created, and 40 images set in the film. I'm just checking the previous film and adjusting the film. Again, salt image exceeds, and I will increase the TR, and then scan will start. And this is T2 axial, and this is T1 axial. Checking and checking again and again. I take times during filming, making sure that all the images are set perfectly in the film, and also the contrast of the image. And now this is the T1 team axial, and this is a fat set sequence. So select the series and trying to adjust the contrast in the viewing, and checking the image and send it to the filming. And as I set the layout 5 into 8, it adjusted in the film the 40 images, and zoom the image. So I took 3 axial for forearm. One is T1 axial, one is T2 axial, and this is T1 team axial. So all the 3 axial have been ready to be filmed, and now it's time to give contrast to the patient. So after contrast injection, I will take 3 sequence: T1 coronal fat set, T1 sagittal fat set, and T1 axial fat set. So now the T1 axial is running. That I repeated the protocol because this was previous was one noisy image. So I repeat this T1 axial. The T1 axial image scan has completed, and let's check it out. So this is the T1 axial, and now I'm finding post contrast protocols, but I couldn't find this, so I have to make from my protocols. So I repeat and open the protocols and change the contrast head suppression. I take T1 coronal and rename it as T1 TSC coronal FS. So FS means fat set, and of course this is a post contrast protocol that I make, and contrast was given, and now the scan has started. So again, if SAR limit exceeds, increase TR and click OK. So now the post contrast T1 coronal fat set has scanning, and this is the image of the T1 coronal post contrast fat set. So I am checking the image. You can see that the contrast is enhanced, the lesion is enhanced with contrast, and there is some areas of low density or low intensity. So in MRI language you can see hypointense. If the area is dark, this is hypointense, and if the area is bright after contrast, this is hyperintense. So I am printing the post contrast T1 coronal fat set, and the layout is same for coronal 5:4. I take time adjusting the contrast. So now the T1 axial fat set is running, and then T1 sagittal fat set will start after this. So I am waiting for T1 axial fat set to be finished. So this is the T1 axial fat set post contrast. I am selecting the series and sending it to the filming, and in the filming I will select 5:8 so that 40 images covered in the film. Image set in the film, and by adjusting zoom pen and contrast I will print out the film. So my two post contrast sequence have been printed, and now waiting for the T1 sagittal fat set post contrast scan to be finished. You can see on the left bottom corner that the scan is running. The scan has finished. So let's check it out. The T1 sagittal. So this is the T1 sagittal fat set post contrast. I am rotating a little bit so that the forearm is straight, and sending it to the filming, and select 5:4 so that there is 20 segment and the segments are long enough to set the forearm. So this is the last image, last film of the MRI. So thanks for watching. Hope you enjoy the video. If you like this video, please hit the like button and share this video and subscribe my YouTube channel. Thank you very much.